within the deep plane facelift world, what kind of variations are made for individual patients or their anatomies or their needs, maybe their hairline even, if it's a man versus a woman? What are the different variations you can make?
Everybody's anatomy is like actually very different. So like no two facelifts are really the same at all. In the neck, there are different things that contribute to aging in the neck. Is it just skin laxity? Is it muscle bands that are kind of prominent? Is there excess fat? So deciding what you need to address and how. And then in the face, the kind of vector that you're repositioning tends to be fairly similar, but there's a little bit of a range. Can be a little bit more towards vertical, a little bit more horizontal, but generally this direction. And then, the incision. So for men, I'll always give them the option of whether they want the incision to be in front of the tragus, which is this part of the ear, or behind.
The little bump.
Yeah.
Oh, I see.
So it can
like
be
more in front of the ear or
either
hidden behind.
Or hidden behind. Because if you have facial hair and the skin is moved, then you can grow facial hair there.
You're going to have facial whiskers in your ear.
Yeah.
Well, that's okay. That's super interesting. So those incisions, are the incisions like from where do they start and then where do they finish, or does it depend on the patient?
It does depend a little bit on the patient, just based on how much skin needs to be removed. But it starts kind of in this part of the hairline in the temple, and then goes usually behind this part of the ear, and then goes behind the ear here. So it's, well concealed in kind of natural borders and curvature of the ear.
And is there any incision like back behind the hairline, like in the back of the neck or anything there?
Not in the back of the neck, just behind the ear, and then
just behind the ear,
and then like along the hairline right here.
So that's pretty well hidden, I would think, for most people. I mean, there's always a trade-off, right?
Yeah.
So it's like people don't want scars, but they want this lifted appearance to look amazing. You're going to have some scars.
And then they're typically, we almost always do a neck lift with a deep plane facelift. And so that's just a little incision right down here.
Yeah, that little right under their chin. I always see that on actors and actresses because I know what to look for. I'm like, I see what you've done. I've done it too.